Hello, everyone. Thank you so much for taking the time of your busy schedules to join this meeting. I'm Dr. Natalia Dumashahai. I am a general dentist and active holder of RCDSO license, and I'm also a proud member of ODA and ODS, which is Ottawa Dental Society. I am also a virtual OSCE instructor at Confidentist Group. And today at this webinar, we will discuss what you need to know to pass the virtual OSCE exam on your first attempt. So without further ado, I'm going to start. At the end, we will have a brief moment. If you have any questions, if anything comes to mind, please feel free to type them into the message box or into the Q&A portion, and we will discuss everything at the end, and not to interrupt during the discussion. So what do you need to know? And first of all, this is just an important disclaimer. Confidentist Group, as you probably know, is a private educational institution that is experienced in guiding new dentists through the equivalency and certification processes in Canada. Confidentist is not affiliated nor is endorsed by NDEB, which is National Dental Examining Board of Canada. And you should also know that NDEB, virtual OSCE, and other test names and trademarks are the property of the respective trademark holders, and they are not trademarks of Confidentist Group. So this is something you need to know. And so today on our agenda, what we have in stock, you will understand what virtual OSCE actually is and what makes it different from other exams. And I know you've experienced a lot of different exams in the past, but this one is a little bit extraordinary for that matter. What is the mindset of a successful candidate? What usually makes candidates struggle, and what you need to avoid to be successful on your first attempt? What type of questions you can expect, and how the actual scoring works. And also, we will briefly discuss what the preparation would look like and how the Confidentist Group would be able to help you in that journey. So what is virtual OSCE? So as mentioned by National Dental Examining Board on their website, I'm sure you've familiarized yourselves with it. Virtual OSCE is National Standard of Competence for dentists in Canada. It is aimed at assessing your problem-solving and critical decision-making skills required of beginning dental practitioners. So you know that the stakes for OSCE are very high. This is your final stepping stone to become licensed dentist in your province of choice. This is no longer a school exam anymore. This is your true gateway to practice. So as you probably heard previously, it used to consist of two exams. It was written examination and OSCE. But since COVID-19, it has been combined into one-day exam, which is virtual OSCE. It is entirely computer-based examination, and it takes place for multiple hours within one single day. So there are no more physical stations. It's just computer-based exam. And what is the structure of the exam? You have 200 total of questions. The entire exam lasts for approximately 6 hours. There is a break in the middle, and you will have approximately 50 standard multiple choice questions and 150 case-based questions. What type of questions we will discuss further on. And all of these questions, they could include additional supporting material, which could be photos, radiographs, different types of charts that you will become familiar once you start preparing for the exam, or other media. we don't know that this exam is obviously fully developing. It's changing. So far, there were multiple different media available to candidates during the examination that would support you to come up to a final decision and final result. As you also know, there are only three maximum attempts at this exam. And as per results, there is no cutoff point for each exam. Every exam differs depending on the difficulty and depending on how successful the candidates are. The passing rate differs. And so after every single exam, so the results are subjected to analysis by National Dental Examining Board, and they are determined based on the complexity of the exam and also based on the performance of successful as well as on unsuccessful candidates, which means that if majority of candidates did badly, there is a good chance that the passing standard will be lower. But if majority of candidates did really, really well, even if you did good on the exam, there is a chance that you may not pass. So it really, really depends not only on you, not only on the exam, but how well the others are doing. So the next, what is the examination blueprint? So it is available on NDEB website, and you can familiarize yourselves with the approximate distribution of questions, or what type of questions you will see in different categories. So you have categories such as operative dentistry, periodontics, oral medicine, pathology, pain management, medical emergencies, complex patients, endodontics, prosthodontics, surgery, orthodontics, and a combination of all or multiple categories in one. And to familiarize yourself a little bit better with what the distribution is, you can find a virtual OSCE blueprint that will describe exactly what the content is and give you the approximate percentage of questions in each area. And you can find it under Virtual OSCE Protocol on the National Dental Examining Boards of Canada website. And also important note that each category could include different scenarios, different types of questions, and there is no specific category for radiology and dental anesthesia, but those could be distributed between different complex scenarios and between different categories. So what is important? Important is one of the first things that you need to do, you need to change your mindset. So you are no longer a supervised student on this exam, you are an autonomous practitioner. This exam not only assesses your theoretical knowledge in specific areas, it does that too, but this is not uh, the main assessment that this exam does. It is designed to determine your problem solving and critical decision-making skills that are required of dental practitioners that enter practice. So this shift from student to thinking to general dentist thinking needs to happen. You are expected to combine the knowledge that you have obtained throughout all of your years in dental school, and you need to arrive at proper diagnoses, appropriate treatment plans, appropriate timelines, and you need to determine next steps for your virtual patients and their management. You need to confidently shift between different disciplines and be able to make critical decisions with limited information available. So just like in your own practice, once you enter your practice, you don't get full information on patients. Unfortunately, oftentimes you're dealing with limited information. And right now in textbooks, you're used to seeing multiple scenarios, different descriptions. Even in when you review templates, you will see that, oh, there is a lot of information available. During the exam, that does not have to happen. Obviously, there could be 15 symptoms of a specific condition, but you may have just two of those or three of those. You need to be able to confidently differentiate based on information available. And also, you need to make sure that you will avoid all the distractors that may be present during this exam, and that may be present even within the actual questions or answers. So for this exam, there is no more student thinking. Now this is time to implement your general dentist thinking. And it's important to remember that for clinical judgment questions, there is no black and white. Majority of answers, they lay in the gray area. And in our day-to-day practice, as you will see once you enter your practice, there is a lot of gray area in our day-to-day life. So why this mindset shift is so critical? So NDB is expecting you to demonstrate entry-level competence for independent practice. You must show that you are ready and prepared to manage patients without any supervision from day one of licensing. So you do not, obviously, most of you will be looking for practices where you can have mentorship opportunities, where you will have older colleagues that will be able to guide you through your practice. But for MDEB, it's important that from day one, even if you were to open your own practice, that you are ready to deliver appropriate level of support to your patients and that you will be providing them with critical and correct level of care. Another thing that is really, really important, your dental school assessments were preparing you as a student. And virtual OSCE is assessing whether you're ready to be somebody's dentist, whether you're ready to diagnose, to plan, and to manage their care autonomously. For this exam, success requires not only memorization of theoretical material, which you already know, you have